career that's grown from the heart.
Medical reporter Dina Bair has an inspiring update.
We first met Mackenzie Tannhauser in 2011. She had spent weeks in the hospital waiting for a new heart. At just 17 years old, she passed the time by documenting her journey. Now an update, 11 years in the making, and a rare chance to see a transplant patient thriving in a career born from her own medical experience.
Mackenzie's been in here for about a week and a half now.
Long before TikTok and Instagram exploded,
every 2 hours, my nurse has to check my vitals.
there was Mackenzie Tannhauser. The then high school senior took up video blogging as she waited for an organ transplant.
They took an echo of my heart and they showed me the echo, and the left ventricle of my heart was significantly a lot larger than it should be. One of the motivations for making the videos that I did during my treatment was to inform younger patients and other families on what it's like to be on the waiting list and go to all of the procedures that are required for an organ transplant.
She suffered with dilated cardiomyopathy, an enlarged heart that was no longer pumping properly. In September 2011, she posted regular updates during her hospital stay, including the moment she heard the news.
She's like, "Kenzie, I have some good news for you." And I was like, "Oh my goodness, what is it?" And she said, "We found a heart for you." And I was like, "Oh my gosh, you're kidding, right?" It's such a gift, it's awesome. That's all, bye. Wish me luck.
We visited Mackenzie just days after her transplant.
I feel good though. It's just tough for the first couple of days.
The experience helped launch her career, not in blogging, but in biomedical engineering.
You know, I wanted to be able to help people, and I wanted to be able to use my experience as a patient to kind of improve the lives of others. After the suggestion from one of my electrophysiologists, heart doctors here, to look into biomedical engineering, that's actually what I ended up studying in college.
Yeah, so I'll give you the tour of what the new unit looks like.
Great.
The now healthy 28-year-old is a clinical field specialist at Abbott, a global healthcare company.
I get to work on our clinical trials in our cardiovascular unit, which essentially means that I get to help patients around the country and kind of our latest breaking technology to enroll them in clinical trials. So I help train physicians and I support surgeries and follow up with patients to see how they're doing. We work on anything from stents that open up blockages to the vessels, to stents that open up blockages in the legs that are preventing people from needing amputations.
The vascular division where she works is loaded with female scientists, many inspired by STEM classes in high school and college. Now Mackenzie wants to inspire others with her story.
I've been really fortunate that with this transplant, I've kind of been able to, go on and live as full of a life as I can. I hope that I can use my story to show, the impact that engineering and biomedical engineering has on patients like myself, so that I can help motivate other young women to give the career a try.
September 7th marks the 11-year anniversary of when Mackenzie received the ultimate gift of life. If this story inspires you, we have organ donation links on our website. Back to you.